Hi, my name is Sarah Cartwright, and I'm presenting on the ketogenic diet on behalf of my group members Jennifer Belmont and Julia Green. So to start, we're just going to review what a ketone actually is. So a ketone is a simple organic compound. There is a carbonyl group, which is the carbon double bonded to the oxygen, that is bonded to two other carbon groups. Ketone bodies can be generated by metabolic processes, and an elevated level of ketones in the blood is known as ketosis, but more will come on this later. And many sugars are ketones, known as ketoses. The most widely known of these is fructose. And that will conclude our little review. Enough of organic chemistry. So how does the ketogenic diet actually work? So the basis of it, like many other diets, is a macronutrient manipulation. So an individual following a ketogenic diet needs to induce metabolic acidosis, also known as ketosis. So to accomplish this, macronutrient manipulation is necessary. The carbohydrate intake should drop drastically to about 5 to 10% of the daily diet. Protein should roughly be 15 to 30%, and fat should make up the majority of the diet at 60 to 85%. This doesn't take any particular skill other than being able to distribute macronutrients correctly, which is imperative for the body to reach the state of ketosis. A ketogenic diet doesn't require any special foods to be added into the diet or have a branded shake or bar, so interested dieters can make the keto diet fit into their budget. So the ketogenic diet came about in the 1900s when there was the first modern scientific studies done concerning fasting as diet therapy and a cure for epilepsy. And that was done in 1911, and then 10 years later, an endocrinologist discovered ketone bodies in the blood as a result of fasting or a diet rich in fat and low in carbohydrates. Russell Wilder from the Mayo Clinic coined the term ketogenic diet, and this diet was used as an alternative to fasting for the treatment of epilepsy. And children were the primary targets of this diet treatment. But a noted side effect of following the ketogenic diet was weight loss. This unintentional side effect has gained popularity as a weight loss solution. So how does it work? The appetite is reduced due to increased satiety from proteins and suppression of ghrelin. Lipogenesis is decreased and lipolysis is increased. And the body becomes more efficient at digesting fats, as evidenced by a decreased resting respiratory quotient. So that means fats are the primary energy source. And an increase in the thermic effect of proteins. So is any of this true? The reasons given will all promote weight loss, but along with the ketogenic state, most people who follow a true ketogenic diet are also restricting calories. One could argue that the caloric deficit plays a role, as it is common knowledge that calorie deficits promote weight loss. The fact that true ketosis suppresses ghrelin is helpful, as people who follow it will have an easier time restricting their calorie intake as their appetite is suppressed. In the first few days after starting the keto diet, a person can experience a significant loss of water weight. When the carb intake is restricted for a few days, the glycogen stores in the muscle are reduced. Glycogen is responsible for water retention, so when its levels fall, so do our water levels. The diet appears to be working because the number on the scale is going down, but since most of this weight lost is water weight, it will return when the person goes back to eating carbs. While most people rely on scales to monitor weight loss and think any weight loss is good, the goal is to lose fat, which isn't always reflected on the scale. So what about those raspberry ketones? The raspberry ketones are a supplement that quickly forces the body into ketosis, so energy is derived from fat rather than carbs. And Dr. Oz had them advertised as a miracle fat burner in a bottle. And they became popular after Dr. Oz featured them on his show. But research in animals has shown that raspberry ketones might increase measures of metabolism, and it also might affect a hormone in the body called adiponectin, which can increase the rate at which the body burns fat and reduces appetite. But again, these studies were in animals. There have been no reliable scientific studies done that raspberry ketones improve weight loss when taken by people. So the nutritional qualities of this diet are lacking, again, because there is such a severe restriction of carbohydrates down to less than 50 grams a day, which can lead to deficiencies. Also, limiting grains and starches can create diets that lack in fiber and essential vitamins and minerals such as potassium, vitamin C, folic acid, zinc, vitamin A, as well as others. And to combat these deficiencies, supplementation like a daily multivitamin will likely be needed. Additionally, a high-protein diet with low carbohydrate intake can be toxic to the kidneys. So here's a closer look at the keto diet food pyramid. You can see at the base are a lot of meats, healthy fats and oils. You have some non-starchy vegetables. And then as you move up the food pyramid, you move into the foods that they call for more restriction of. So you have the all of the grains and the really sugary fruits and things like that up towards the top of the pyramid, indicating intake of them should be lower. So comparing the keto diet to the ideal diet. The keto diet is definitely not complete in all nutrients because all wheat-based grains, fruits, beans, legumes, root vegetables, you have to avoid all of those. The diet is strictly high fat and protein, and foods that you need to include, again, are the meats, fatty fish, eggs, cheese, avocados, and healthy oils. So with a focus on these foods, the diet will be high in fat, protein, and calcium. The keto diet does induce satiety. It leads to a reduction in appetite due to higher satiety effect of proteins, and also the effects on appetite control from the hormones. And researchers have demonstrated that increases in circulating ghrelin and subjective appetite with a reduced calorie diet were decreased with a ketogenic approach. A period of low carbohydrate ketogenic diet may help control hunger and may improve fat oxidation metabolism and therefore reduce body weight. Is the diet simple to follow? This is a yes and no answer. It really does depend on the individual. Sample meal plans are available online, and websites have information on what is provided and what is allowed. But it might not be easy to follow because it's so strict that people may get confused about what they can eat versus what they can't eat. So maybe if someone was having trouble, something like a food log or a food diary would help them out. Is the diet cost prohibitive? This again is a yes and no answer. So the diet is cost effective because all of the items that are included are readily available. And it doesn't include any specific food items that cost more, so people can definitely go shopping at their grocery store, use coupons. But if nutritional supplementation is needed, and it is recommended with this diet, that can get expensive, especially if a person is going to be taking shakes or multivitamin regularly. And some of the foods allowed on the diet, the healthy fats like avocados, nuts, and healthy oils, those can be expensive as well. As far as being flexible, the diet is flexible. There are actually 4 different types of ketogenic diets. There's the standard, which is very low carb, moderate protein, and high fat. There's the cyclical ketogenic diet, which involves periods of higher carb refeeds, such as 5 ketogenic days followed by 2 high carb days. There's the targeted ketogenic diet, which allows you to add carbs around your workouts for more energy. And then there's also the high protein ketogenic diet, which is similar to the standard ketogenic diet, but it includes more protein than the standard. And then the cyclical and targeted ketogenic methods are definitely more advanced, not very simple, but they're used primarily by bodybuilders or professional athletes. So marketing. The ketogenic diet is actually helpful for some people with obesity and hyperlipidemia because it does result in weight loss. And one study found greater weight loss with the ketogenic diet than with a low-fat diet, and also had improved triglyceride levels. And as mentioned earlier, the ketogenic diet has also been shown to reduce seizures in those with epilepsy. However, the ketogenic is in the limelight right now because of its popularity as a method for weight loss rather than as medical nutrition therapy. So there are definitely cognitive distortions present when looking at the ketogenic diet. Articles are often published with headlines reading, "The ketogenic diet might be the next big weight loss trend, but should you try it?" So this definitely catches people's ear. This particular article was posted on health.com, and it says that the ketogenic diet is roughly 75 to 90% of daily calories from fat, 6 to 20 from protein, and 2 to 5 from carbohydrates, with the goal of achieving ketosis, a state in which the body is using fat as its primary fuel rather than carbs. And then it states after 3 to 4 days on a ketogenic diet, backup stores of carbs called glycogen become depleted and ketosis kicks in, which triggers some weight loss and the appearance of a leaner physique. So this has definitely got cognitive distortions present. The first being filtering. So the purpose of the diet is to achieve ketosis, which is when the body uses fat as its primary fuel. The article also states that glycogen becomes depleted and ketosis kicks in, which triggers weight loss. But what the article is not explaining is that when ketosis occurs in a diet with less than 50 grams of carbs and glycogen stores are metabolized, it's water weight that is lost, which can also lead to dehydration, and it can also lead to a chemical imbalance in the blood. A second cognitive distortion that's present is polarized thinking. So the diet can lead to polarized thinking as it makes people think that this diet is easy and will lead to weight loss, which is true, but it can also lead to deficiencies in essential vitamins and minerals like we already discussed. It can also be too high in total fat, which includes saturated fat along with cholesterol, and we all know that can lead to other health issues. So the overall promise of the ketogenic diet, it is important to point out that ketogenic diets have their place when used in a supervised setting. So these diets, often referred to as very low-calorie diets, are implemented by medical professionals for patients who need to lose a significant amount of weight in a short amount of time, usually for a medical reason, such as a necessary surgery. But we would not recommend this diet for clients just generally interested in losing weight. The overall promise of this approach is minimal. Yes, the diet does lead to weight loss. However, this is something people will be able to follow long term with so many restrictions. People who are looking for weight loss might not want the stress of following such a strict diet and potentially needing supplementation. Attempting a ketogenic